Welcome back to another episode of Nurses with Voices. I'm your host, Dr. Lindra, and today I have Ty Hagler with us. You mentioned wanting to change healthcare innovation from a technology push to a market pull, and just explain a little bit more about what you mean by that.
I think of nursing has the misfortune of being the settlement layer where you have top-down decisions and that have, they're in the abstract, they make sense. Because there's not training for nurses to be able to help really articulate the problem, the engineering team will go, this is weird and scary and doesn't sound like something I can engineer my way out of. So therefore, I'm going to filter a lot of what I'm hearing down to something that makes for a technology.
Welcome to Nurses with Voices. I'm Dr. Lindra, your host and fellow nurse who's traded in burnout for breakthroughs. I'm here to show you how to transform your nursing career into one filled with purpose, reduce stress, and incredible opportunities. Whether you're looking to start your own business, build generational wealth, or simply find a healthier role in nursing, this podcast is for you. Join me to explore practical strategies to overcome burnout, combat bias, and chart new paths in nursing. It's time to reclaim your voice and reimagine your future in healthcare. Let's get started. Welcome back to another episode of Nurses with Voices. I'm your host, Dr. Lindra, and today I have Ty Hagler with us. Ty has spent his career not just as a creative, but in teaching others to be creative, both as individuals and in team settings. His mission is to change the culture of healthcare innovation from technology push to market pull. And the change starts with educating physicians and nurses to take a empathetic approach in solving the wealth of problems in our healthcare system. And I love that Ty addresses this because so often certain things are just not talked about and not discussed. And we need to really start looking at other innovative solutions. Ty, why don't you go ahead and introduce yourself so that we can dive into the mission of your business and like what you're doing for healthcare.
And thank you so much for having me on this podcast. Nurses with voices, absolutely. Like this, I think nurses need more voices because they've systematically, historically not been given voice, and the work you're doing is so important. So for my background, I've got my undergraduate degree is in industrial design, which healthcare doesn't often interact with us industrial designers. But so industrial engineering is systems and kind of figuring out supply chains. Industrial design is about like, how do cars look? How do shoes look? How do you make things look good? So my undergrad is from Georgia Tech in industrial design. I then was at Home Depot as part of the in-house innovation department for about 4 years. And so that was an eye-opening experience to figure out how innovation works in big box retail for consumer products. Went back to school, got my MBA at NC State. As part of founding Trig, was like, okay, I've got to run a business, figure out how to do that. Let's get an MBA. And then I think I probably used the MBA in a different way than most people would. I took it as night classes. But, as part of the MBA education, got exposed to medical devices. And some of the early products I got to work on were ones that changed outcomes, saved lives of children, and then that was something that just kind of blossomed and matured as we really started furthering to invest in that. And then as was looking at the reasons why medical devices fail, too often it's because nurses aren't consulted. Mm-hmm. And there's like some stories out there of medical device companies, major medical device companies, will easily spend up to $500 million in development costs. Then find out that we should have talked to the hospital, we should have talked to the end users in more detail, but seek disconfirming evidence, not just, we checked the box and we're validating things, but no, shut the project down early rather than wait to the very end at commercialization stage, because there's so often you can feel like you're doing activity as though evidence of that you're making your way to a successful commercialization. And you're working your way towards a goal that you ultimately will, like you're climbing a mountain to realize that the mountain has a sheer cliff on the other end. There's no rainbow on the other pot of gold at the end of the rainbow there. You're just like, it's just done. So like figuring out the right mountains to climb, the right ideas, the most meaningful projects to work on is so much a part of early stage of innovation. Part of the education is like helping people to learn from the significant mistakes that have gone before in the field of innovation.
I can so appreciate how you mentioned that no one consults with nursing when they come up with these solutions that are going to affect our workload. They're going
Mhm.
to affect our productivity. There's so many areas of nursing that is going to affect, and no one consults us. Even when it comes down to, building new wings of hospitals, right?
Oh,
And just even going back to electronic documentation. Initially, and I'm sure I can pull some facts that back this, that is what really paved the way for nurse informatics. Because when they started implementing EMRs, electronic medical records, the first thing we were saying was, who created these systems? Because clearly they didn't consult nursing when they started creating these electronic documentation systems, because nothing made sense. And once they did start to consult with nursing, it started to make more sense. And then the
mhm.
workflows became better. I know with anything that's new, there's going to be challenges, there's going to be struggles, but there was clearly no consult with nursing when they initially implemented electronic documentation. We've come a long way now, but I just use that as an example
Oh, yeah.
because it's so important. If you're going to spend $500 million on a solution, you better consult with the stakeholders. And I don't just mean those executive leaderships. And and that's another reason why I'm taking this time to pivot the podcast somewhat, because other perspectives matters as well, right? Your stakeholders are not just the nurses in leadership. Your stakeholders are your bedside nurses. Your stakeholders are professionals like yourself who have innovative solutions for nursing and want to partner with nursing and or the healthcare profession so that you can have innovative solutions that are going to impact positively the workflow. You mentioned wanting to change healthcare innovation from a technology push to a market pull. Can you share some examples where this shift made a tangible difference in patient outcomes, and just explain a little bit more about what you mean by that?
Yeah, I'm glad you referenced that. I mean, like what you just talked about with electronic healthcare records was very much a technology push, idea first approach of, like we've got problems with paper documentation. So therefore, we're going to centralize everything, top down mandate everybody start using this system. And then start like doing this iterative without really a true North Star in place in terms of let's prioritize the end user. I mean, I think of nursing has the misfortune of being the settlement layer
Mhm.
where you have top down decisions and that have, like they're in the abstract, they make sense. But then when it filters all the way down to the reality of you're making decision A versus decision B at the bedside, that's where the consequences of an abstract decision brought down to reality then get the nurses bear the brunt of that. And there's not a feedback mechanism back up to the policy level decision in order to make those changes. And I think that's a significant, just overall approach to how healthcare innovation emerges, because there's some fundamental biases that come from a technology push standpoint. That so basically, some of the problems that have emerged are due to policy. They're due to basically like how we're getting feedback. And so is that you have a say like a class of biomedical engineers that are all bright-eyed and bushy-tailed, eager to go find problems within healthcare, and you go start talking to nurses and you ask nurses what the biggest problems they're facing, and nurses will take a risk and start unloading on like, well, these are some big problems I'm facing. And because there's not training for nurses to be able to help really articulate the problem, the engineering team will go, this is weird and scary and doesn't sound like something I can engineer my way out of. There's no like mathematical formula, there's no like obvious technology solution. So therefore, I'm going to filter a lot of what I'm hearing down to something that makes for a technology. And I think that's 95% of healthcare innovation that's happening today. And I think the revolution that you're really starting to see happen is with nurse-led innovation, is that nurses can serve as the North Star, meaning that you can be the one to like filter out the bad ideas. We're going to have a lot of ideas that generate, And then also as you start getting into basically like, well, we can go this way and go that way and add this feature and like, add all this functionality, because that happens over the course of product development where you're constantly diverging. And I think the nurse filter of just that truth telling and pragmatism of like, I don't care about any of this that you guys are talking about and dreaming up over here. It has to serve this job. Don't make it more complex. Don't add to my workload. Fix the problem. And I think that source of reality and ground truth is so often missing because it's there's not, like you don't have a lot of people that are sitting at bedside. It's nurses that are sitting there, and they are a source of truth and need to be in a leadership role. The challenge that's been in the barrier there is that the mindset required to do innovation is different than the training you get in nursing school. And it's a relatively simple flip of the switch, but it's also something that's not part of that framework and understanding. So, and this comes down to, you have to, like within medicine, particularly, I mean, like medical schools as well with physicians also have this training that you want to always be right. If you're ever wrong, then that's catastrophic in a healthcare situation, a critical situation. If you're ever wrong, if you misdiagnose, then you have it's like downside risk for the patient. There's, like a lot of risk associated with being wrong within healthcare. From an innovation context, you are wrong 95% of the time, maybe 99% of the time. But when you are right, then it has significant upside potential. And so it's really a shift in thinking from being always right to being only right once. And the way that you seed and navigate in an innovation context is very different than what you navigate from a bedside standpoint. However, if you can navigate that flip in mindset, then that's something where you can then start testing experiments in a controlled environment, not at bedside necessarily. But I do think that also nurses come up with some of the best kind of like, let's call it MacGyver duct tape solutions at bedside that like you get the empirical feedback on that. But then if you do come up with something and you validated it at bedside, then nurses need to be taken seriously and be able to participate in the upside when you do identify those opportunities. But that's also something that and so one of my first projects that like I worked on at Home Depot was one where I had identified a new market opportunity. It was something that my boss had given to me of like, hey, this, young kid's coming in, let's give him a challenge. And then came back with something that was a great idea that was going to transform, one of the entire product categories within Home Depot. And so it checked all the boxes of my design training, but from a business strategy standpoint, it got shut down pretty quickly, in part because the organization didn't know how to understand innovation and also navigate vendor relationships and who really to believe in terms of your feedback on a given idea. But when it comes to the complexity of actually bringing innovation to market, the better question to ask is who? Can I find the really good regulatory consultant who has expertise in the relevant regulations for my specific idea? Is this something that from a health economics and market access standpoint that I can find the right reimbursement pathway for this? Or is this just a direct to patient, out of pocket expense? There's, or like for patent attorneys, like when's the right time to engage a patent attorney? And is a patent actually market validation or is it just a tax on your idea? There's a lot of different concepts to play through, but then finding the right team to assemble around you so that you can be more effective and also not take you away from the biggest source of strength that you have, which is connection with patients and bedside and that ground truth, so that you can be the North Star for this team of experts that assembles around you so that it can stay within your source of strength and also like your ability to lead that team without having to be the most knowledgeable person in the room. You just are the closest to the truth.
It's interesting. Nurses have been talking about workarounds, right? That's what they are. They're workarounds. We duct tape things. I won't name the organization. However, I can think of one nurse who she created a device where you wouldn't have to disconnect the IV tubing. You can just hang your IV tubing, and because your tubing would be changed every 72, 96 hours, depending on your state or hospital. So instead of having all of this different tubing, you have one tubing, and the one tubing actually can attach the different piggybacks. And she actually created this on the organization's time. And because of that, the organization owned it. So she wasn't able to patent the organization, rolled it out, and everyone loved it. But again, this came from a nurse. So
Mhm.
we're very innovative with solutions because we see all the time what needs to be done, but no one teaches us the innovative side of taking this idea and partnering with a technology company or partnering with a business that can really help us market this and roll it out effectively. And I also remember working at an organization where the CNO, she created this acuity system. We did the research for her. She created this acuity system, and all of the nurses, all of the charge nurses, they would do the acuity for each shift. And, after 6 months or a year, she took the idea and she pitched it to a company. And just like that, she was a millionaire because it helped with the acuity and it helped. And we've been talking about acuity in nursing and healthcare for years, right? That's one of the things I know a lot of union workers, I should say. That's one of their biggest things are acuity and
Mhm.
staffing and making sure staffing is appropriate for acuity models. Well, here you have a chief nursing officer who pitched the idea to a company and basically became a millionaire off of the idea. So
Wow.
there's so many ways of being innovative. And we know as nurses, when it comes to what we need, right? When it comes to our healthcare, what we need on the front line, we know. And I guess what my question to you would be, how do you integrate insights from frontline healthcare workers like nurses into your product design process? And what role do they play in shaping the healthcare innovations at Trig?
That is such a good question. And I think it's a complex answer. And I want to back up a level because you touched on the organization owning the rights to the intellectual property that was created. So if you are working at, say, an academic institution or a hospital that has an active intellectual property capture mechanism within their hospital, that is something that oftentimes is part of your employment agreement. That
Mhm.
if you're creating intellectual property, if you're generating ideas during your time in that hospital, then they do have the ability to basically take ownership, have power of attorney over the intellectual property. And so then that becomes a question of, and I think to you, the individual innovator, what is the value proposition that your organization is providing to you that you can trust them with your idea? But I think that's a question back to your local context and the employment agreement you have with your institution. And to just ask some hard questions of, if I trust you with an idea, I haven't come up with one yet, but if I do trust you with this, what resources do you have in terms of helping me to secure and protect the patent? That is
Mhm.
valuable
Mhm.
because a large institution protecting a patent is much more intimidating than, say, an individual who has just barely enough money to file the $15,000 to get a patent. And
Mhm.
then the real value of the patent is in the litigation afterwards to defend the patent. So there is a source of strength there. There is a value proposition to make sure. But you also want to understand what the upside is back to you, the inventor, if there are, like royalties that come out of it.
Share with the listeners what you guys are doing to integrate these insights for nurses at Trig.
So Trig, at its core, we're a industrial design consulting firm. So we do offer training. We also offer innovation management, so helping a pipeline of ideas for an organization go through and reach maturity and commercialization. And then we do work in, say, like market research, kind of physical prototyping and product development. For anybody who's watching on video, you kind of have I have an array of different devices that we've worked on and helped commercialize behind me here on the display shelf. We also get into developing brands for those products we design and also developing digital experiences in terms of UX layouts, websites, commercial landing pages, that kind of thing. So that's kind of our core offering. But within the training, something that we're experimenting with is allowing nurses to go through a process of, how do you scope a problem in the first place and really bracket it down to, like, what is something that's achievable, that's within your scope, that's also not too narrowly defined, but not so broadly defined that, like, like, healthcare is too expensive. Let's solve that problem. Like, well, let's try to bracket that down a little bit, right? And then versus like, we're going to improve the, I don't know, thread count on the sheets by like, a percentage increase. Like there's an array of, like different possible scopes you could have for the problem. So just helping with that as a starting place so that you've got something that's one, validated and worth your time. Then after going through that early problem scoping phase is then going through our empathy course, where we'll take nurses who have a given problem scope and then walk through a series of validation steps to really make sure you've got consensus on what truly the problem is, so that it's clear to articulate. One of the best examples of this comes from Steve Jobs, where he marketed 1,000 songs in your pocket. There's no solution in there. It's the outcome, it's the unmet need, that by describing that, then you can say, well, how do you actually get 1,000? And today, of course, we have, millions of songs. But like at the time, the iPod was revolutionary because it allowed for that. So I think being able to get to that level of clarity is something we offer in the training. And so some of what we offer is that early stage prototyping, illustration, concept validation that works in concert with the medical innovator, so that we can help to save the overall cost of a development project and make best use of those, kind of whatever grant dollars we're working with. In some cases where we feel like there's a matching problem scope and unmet need, then we will partner with nurses and go through and apply for grants together and put the right structure in place that's equitable for all parties. And that's something that we're working on, putting that structure and a streamlined process in place, which if that's interesting or exciting for anybody, then like definitely encourage you to take the course. We have some free offerings there as well as some paid offerings, but then also looking to have a series of conversations to filter down to some of the really exciting opportunities, but also position nurses as the leader to navigate those opportunities. Because we really just see that as, good practice for innovation, as well as recognizing the strengths and leadership and potential of nurses.
In your experience, what would you say are the most common challenges healthcare companies face when trying to balance innovation and practicality?
So I do think that there's a couple of helpful frameworks that, can be useful to establish that North Star. At the same time, I think, one of my favorite taglines is that, real innovators ship. Is that, you have to, at the end of the day, ship a product. It's never going to be perfect. There is a point in time when you have to stop diverging and push to the next product and just have it be willing to accept good enough. You've reduced, the risk of harm due to use error and safety risks. You've made sure it's something that can be scaled up. At the same time, recognizing it's never going to be perfect. And there's always opportunity for the next product to come out, the next extension, the next idea. And so being able to bracket what is the minimum viable product within a healthcare context so that you have passed the proper safety checks, but then allowing yourself the ability to then move on to the next idea is something that it's very challenging to get that discipline right, because you're dealing with critical use cases and situations, and being able to draw that line in the sand of like what's good enough, it's very challenging.
So, looking ahead,
Yeah.
what emerging trends in healthcare design excite you? How do you see these innovations reshaping the future of patient care and the provider experience?
I am very excited about nurse-led innovation. I think we are facing a technology bubble right now
Mhm.
where, I think, we're overhyped on artificial intelligence right now. I think we're right now experiencing all the limitations of it, just like we did with, like how blockchain is going to revolutionize healthcare. I'm like, yeah, sure, there's some applications, but it's not quite stable enough yet. I mean, like we'll probably go through this hype cycle again in 5 years when we have a breakthrough on like the core functionality. But I think we're on the other side of that bubble and potentially seeing some of the downside of that. I think so much of what we're seeing right now in healthcare is due to bureaucratic debt, not technical debt, but bureaucratic debt, social debt, that I think because nurses have been the settlement layer for a lot of the delayed feedback that's happening from a lot of these policies that are happening. Healthcare is the fastest inflating cost in the United States economy. And yet we also have some of the worst health outcomes of any developed country. So there's a reconciliation that needs to happen. And so much of those challenges right now are like innovation has limited impact on the ability to affect some of these decisions. And so much of these are delayed decisions that need to happen at a policy level. And specifically, I'm thinking about safe staffing for nurses. You talked about acuity earlier. This is something that has only 8 states have any kind of policy around, safe staffing levels. And I think a lot of the hospital administration is saying, well, it's complex. You got to deal with patient acuity and who else is on the floor and all of the different challenges that are out there. But yet there's not a protection in place for nurses of a baseline staff level that you can compare against. If we put, I don't know, like a new AI bot in place, and does that actually make the nurse's workload better? Well, there's no kind of control versus variable testing going on. It's just put more on nurses and, see what happens. And so I think those controls aren't in place. And I do think we need changes to happen at a policy level to fix some of that I think there's limits on what innovation can do. So I do think that the work that you're doing is so important to, I think, be one of the driving forces for making change happen within healthcare in the United States.
Thank you so much. Thank you so much for coming on today. As we wrap up, is there anything I didn't mention that you want to share with the listeners? Please go ahead. Any final thoughts that you want to leave them with?
Well, just one that I'd be remiss if I didn't talk about is our work on couplet care. So
Okay.
this is a postnatal infant bassinet we've been working on. And so we've been going to a lot of the nursing conventions and getting a chance to show this, but it's directly benefiting moms who have had a C-section and making it so that immediately postpartum, the current bassinets are designed for basically a provider to stand over the infant in a nursery. But for a mom who's had a C-section, for her to be able to lift her sleeping baby up, over, and into the bassinet, I mean, she has to invert her elbows in order to safely put strain on her stomach in order to be able to put sleeping baby back in the bassinet. And so this bassinet we've been working on, it cantilevers over the bed, makes it easy for mom to simply place her baby back in the bassinet. And it's something that's led to a 73% reduction in non-medical calls to the nursing station. As part of a clinical study that happened at UNC Health. And we're currently in final regulatory review right now to then be able to start commercializing this, which we're expecting to be able to ship product in Q1 next year. So really proud of our work there, and it's something to check out. So yeah, coupletcare.com.
Coupletcare.com. Where can people find you?
Yeah, definitely LinkedIn. Reach out to me, Ty Hagler, and also Trig.com is our website, and you can learn more information about what we're up to.
Well, there you have it, everyone. Until next time, make sure that you stay inspired, stay educated, and stay empowered. And thank you so much, Ty, for coming on today.
Thank you, Linda, for having me on. This is a great conversation.